Hi, I'm Paulina Nassab, Senior Genetic Counseling Manager with Vitrolife Group.
Hi, I'm Liya Rabkina. I'm a genetic counselor with Vitrolife Group.
Liya, thanks for joining me today. There was a wonderful oral presentation given by Sam Rain yesterday on a unique and complicated PGT-M case, and you were actually the genetic counselor for that couple. So I'd love to hear a little bit more about the case, what makes it unique, and why it's important for us to present it on a larger stage like an ASRM conference.
So this is a very interesting case because the couple presented to us with the partner's maternal grandfather having recently been diagnosed with Huntington's disease, and they actually passed away from the condition and found out post-mortem that they had the diagnosis, and no other family members had been tested, and none of them wanted to know their status. So what they really wanted to do was testing for their embryos that would allow them to continue to not know their statuses. At our team, what we did was we had an ethics committee to really discuss what would be most appropriate for this family, and decided that exclusion-based testing would allow for the whole family to continue to not know their Huntington's status and to get those results that they were hoping for from their embryos to reduce their risks for Huntington's. The couple had exclusion-based testing through us and unfortunately did not have very many embryos that were available for transfer. And around the same time, the partner's mother decided to do her own genetic testing to learn her status. And unfortunately, she did learn that she was positive for the condition, which meant that now there was a higher risk to both the partner that we were working with and the embryos. The couple were at this point quite distraught. They came back to us and really advocated to do direct non-disclosure testing to allow for the possibility for a higher number of embryos to be available for transfer. So we had another ethics committee meeting, and we decided on protocols that would be appropriate for this couple to continue to do our best to mask the partner's status. The couple agreed to everything that we discussed, so did the clinical team, and we proceeded with direct non-disclosure testing. At that point, the couple had a whole lot of embryos that were available for transfer, and the partner decided to take his chances and do his own genetic testing. He learned that he was negative, which is, of course, amazing news, and they ended up deciding not to proceed with IVF and are currently pregnant and expecting next month.
That's wonderful news. It sounds like a positive outcome in the end for this couple. I think a lot of patients don't know the options that might be available to them if they have a family history of an adult onset condition, where they might not want to know their own carrier status given the toll that it might take on them emotionally. And so non-disclosure PGT-M testing like this patient pursued is a great option for them, where they can still test their embryos but not learn their own status. You mentioned two different options when it comes to non-disclosure PGT-M: the direct detection method, which actually involves the laboratory testing the at-risk or carrier person that's at risk to be a carrier of the condition, and then testing the embryos accordingly, versus the exclusion-based option that involves knowing which family member was at risk and identifying the haplotype or the copy of the gene that could be at risk and excluding up to 50% of the embryos in that way. There are pros and cons to both options. I think a laboratory may be able to offer both options, and something that's certainly available through the Vitrolife Group. So if you have a patient as a clinician who may be able to benefit from the option of non-disclosure PGT-M, or you as a patient would be interested in non-disclosure PGT-M, we have a team of genetic counselors. We'd be happy to help and discuss these options further with you. So reach out to us at gc@igenomics.com, and we're always happy to help. Thanks for joining me, Liya.
Thanks, Paulina.